The in-office exam is meant to determine what structures and movements are causing the pain the person is experiencing and also rule out what is not causing the pain. The exam usually starts by observing the patient walking into the treatment room. Are they able to walk, or is there a limp? Are they avoiding a certain part of their foot because of pain, or changing their gait or walking pattern at all due to the pain? After observing the patient walking into the treatment room, we move into the history, where we discuss the pain location, the quality of the pain. Is it sharp? Is it dull? If there was any change in routine that might have brought the pain on, what makes the pain better, what makes the pain worse, and if there's been anything done already to address the pain. After the history, we move into the physical exam, where we start with active movements to assess if engaging the muscles and moving that area of the body is painful, like going up onto your toes and raising up onto your heels. After the active movements, we move into passive movements, where the provider is moving the area of the body for you to assess if the ligaments or joints are causing the pain. Then we move into palpation, where we assess the sensitivity and tenderness of the muscles, tendons, ligaments, and joints to both pressure and movement. We start locally at the site of pain in the heel, and then we move out to assess the ankle, the rest of the foot, and even up into the calf. There's one area that's usually pretty sensitive with plantar fasciitis. It's the medial or inner part of the heel or calcaneus, called the medial calcaneal tubercle. We would perform muscle tests to assess if a particular load on the muscle creates the same pain in the heel. Muscle testing would be performed on muscles in the bottom of the foot and the calf. Depending on the person's activity level prior to and since the onset of their pain and injury, we might also perform higher load movements such as single leg exercises or explosive movements during the exam. Depending on the circumstances of each case, X-rays might be recommended to rule out a bone spur or stress fracture of the heel or calcaneus, but this is not usually the case with most presentations of plantar fasciitis. Because we have peripheral nerves that travel through the thigh and leg, which can also cause heel pain, and the lower back can refer pain to the same part of the foot where we feel plantar fascia pain, it is beneficial to assess these areas using orthopedic tests of the lower back and nerve tension tests to rule out those structures as the cause of pain. Once the exam is complete and we are confident we are dealing with plantar fasciitis, we can move on to the in-office treatment.